Hello, and welcome to the Department of OBGYN at Tufts Medical Center. My name is Dr. Megan Evans.
And I'm Dr. Ingrid Liff.
And we are the program directors for the Tufts OBGYN Residency program. Here at Tufts Medical Center, our mission is to train clinically competent physicians to be tomorrow's leaders in obstetrics and gynecology.
Today we are taking you on a virtual tour to see the places and the people that make training at Tufts Medical Center such a special place.
I came to Tufts because I really wanted a program that let me experience the full breadth of OBGYN. I think it was really important for me to walk the walk, where I was exposed to all of the subspecialties, what it was like to be an academic generalist, a community generalist. I wanted my options open so I knew when I was choosing my next path that I was sure I was going down the right path.
The reason I came to Tufts is because I wanted to leave residency as a superb physician and surgeon. And I've always felt strongly that our patients are the ones that teach us the most. So at Tufts, we care for a very complex obstetric and gynecologic patient population. And in doing so, that offers us an extraordinary opportunity for training and for learning.
Training at Tufts was excellent, and it prepared me well for my career ahead. And I specifically wanted to stay at Tufts because of the population that it served. Tufts is right in Chinatown, and it serves a very diverse patient population. And having grown up in this community, I knew that this was a patient population that I wanted to serve and give back to.
We have a great training program, and all the faculty are dedicated to training great clinicians and leaders in our field. In fact, there are many former trainees that are serving in leadership positions around the country. Our department and the medical center are dedicated to providing the best care for our patients, and we try to do that whenever possible, closer to their home or in their community. We see the more complex patients here every day, but we also understand that what's driving our care is trying to make it family-centered.
Hi, I'm Erica Werner. I'm the chair of obstetrics and gynecology at Tufts Medical Center. I came to Tufts in the fall of 2021, and I've been lots of places during my career in obstetrics and gynecology, lots of really amazing places. But I chose to come to Tufts because I think it's a really unique, special environment, and one that I'm hoping you'll find to be special too. As I go around and meet with lots of different departments and lots of different leaders at Tufts Medical School and Tufts Medical Center, I'm blown away by how everybody is all about the patients all the time. And as learners, they also will be all about you. And I think that's just a really special place to do residency. It's important for you also to know about one of the things that I'm most excited about that's growing in the department, and that's research. We just hired a master's trained analyst for the department, and that person will specifically be assisting residents with their research projects, as well as fellows and junior faculty. We also have a number of research assistants who are dedicated to helping to recruit and retain patients in prospective studies for the department. I think there's a ton of things that residents can do in terms of research, but one of the unique opportunities here is that we have a very, very robust data warehouse where all obstetrics data has been kept for many years, and you can do obstetrics or gynecological research as a resident without having to recruit patients primarily, and I think that's a really strong resource for a very busy residency program.
A unique part of our program is that advocacy is an incredibly important component of residency training. And we think it's important because, yes, you can advocate for your patient, but it's also important to advocate in your communities, the national and state level through health policy, because at the end of the day, health policy affects how we practice medicine and how we interact with our patients. And we want to make sure that our graduates leave this program confident to use our voices and to be strong advocates for our patients in our field.
Advocacy is a huge part of our program. It's something that all the faculty are invested in, all the residents are invested in. And so we all have our own individual projects that we work on. So I do a lot of advocacy work in family planning and in LGBTQ health. But we also have a curriculum that one of our residents, Preetha Nandi, created so that we have, teaching on advocacy and how we can best be effective.
One big draw for me at this program was the opportunities to learn how to become a physician advocate. I knew that was something that was important to me, having gone to med school on the south side of Chicago and seeing a lot of health disparities just prevalent every day. And coming to this program during the interviews, I met Dr. Evans, who's an incredible advocate and teacher for us. And since being here, I've been able to kind of pursue a lot of different avenues of advocacy. We've written a couple editorials. I've been to DC as well as the state lobby, Capitol House right up the street. And there's just been all this support in this program for us to be the best advocates that we can be.
Simulation is a critical part of resident education. Our residents participate in simulation in the operating room as well as on labor and delivery. They also participate in skills-based education using mannequins, models, and cadaver labs as well. Here we have set up for the residents an on-site simulation training lab, which they have access to 24/7 to practice their FLS skills or other skills that are critical in safe delivery of care to patients.
The residents and nurses work close together and learn from each other all the time. On a daily basis, you're just working with the intern or the chief most of the day. You see the attending here and there, but your main focus is with the residents.
I think it's the mix of the patient's demographic, the severity of the conditions, and the camaraderie among the members of the team. It has the feeling, the dual feeling of a powerhouse academic medical center, and at the same time, the collegiality of a small community place. I think it's a good symbiosis of those two things.
Our residents really get a comprehensive family planning experience. I was a resident here myself and really did not have that opportunity. So when I started back at the institution, I started a Ryan program for the residents. So they spend 2 days a week with me at Tufts Medical Center, where they see patients in clinic. We take care of patients having abortions in the first and second trimester, patients having miscarriage, and complex contraception needs as well. We do a lot of LARC procedures for our patients. And then the residents have opportunities to come with me to Planned Parenthood, where I'm the medical director, and they're able to see the patients there as well.
One of the, I think, interesting and intriguing things about our program is a very healthy exposure to pediatric adolescent gynecology. Not every program has that, and we have a small division, but what it allows is for continuity of care for young female patients, sometimes who are diagnosed with a condition in utero by our MFM colleagues, and then they're sent here for delivery. So they're born, they're taken care of in our nursery, and then we'll see them from birth until really the end of life in our specialty.
The genetics curriculum is a really unique aspect of our program. There are not many other programs in the country where you would get the experience that our residents get. Genetics is unique in general because it spans the whole span of OBGYN care, prenatal care, sometimes the neonatal care, and then in the gynecologic space as well. So our residents have dedicated time rotating with us in genetics. They spend 2 5-week blocks in their second year in our cancer genetics clinic as an outpatient, learning how to take family histories and analyze those family histories, determine what type of genetic testing a patient would need, counsel that patient about that type of testing, and discuss results with patients.
They have a lot of autonomy from what I can see, particularly from the MFM side. The fellows are there to act more as an attending, and so what we really encourage is a very good dynamic between the fellow and the residents, to have a strong teaching component, to have them be working together, but we encourage the residents to make a lot of plans for themselves and present that as their plan and make that, develop that independence in making those clinical decisions.
My philosophy for teaching is to encourage autonomy. So we do start at least in pelvic floor conditions from the very beginning as an intern. They get exposed with me in the clinic and then in the operating room. And most of the experience is gained as a chief resident in the operating room. The good part of this program, I believe, is the absence of fellows, which allows the residents to be fully exposed to the surgical and non-surgical management of any pelvic floor conditions.
I think the residents have an appropriate amount of graduated autonomy. You know, every dynamic is tested a little bit to see where each person is in terms of their skill set, and then depending on performance and reliability of that performance, residents are able to do a lot more, I think, starting from day one. I like to say that this is a program where whatever it is that you're seeking to be, or wherever you seek to be, or wherever you seek to go with your career, this program has a way of really facilitating that, nurturing that.
I trained here, and part of the reason why I chose this program was because I felt such a strong camaraderie amongst the residents, among the faculty, and you know, what's important is that when you come to work is hard sometimes, and you want to be with people that you care about and care about you and care about your well-being, and that's Tufts. That's why I work here, that's why my husband works here, that's why we had our children here.
We are as lovely and as loving to each other as we appear on Instagram. My class in particular, I think we had a bit of a unique situation going into intern year. Some of our orientation got moved, so we kind of really got thrown in without a lot of preparation. And I just remember about 3 days in, we were all in the call room looking at each other, and I thought to myself, these are probably the most important people in my life right now, because they're the only ones who understand what I'm going through, and that support and love for each other has only continued. In residency, in our second and third years, we're kind of at outside sites a lot, so we don't get to see each other as much, and we've made a point for us to kind of get together as a class every couple of months just to check in on each other and be together.
Many people have asked me over the years, why do you stay there? And I tell them it's the collaborative nature of the place. It's just a wonderful place to work. I love my colleagues. I really enjoy caring for the patients. I know nurses over the years, and there's really not a lot of a siloed feeling. We can reach out to other members of other departments and really cross those departments without any barriers. I also think that some people would call it a tertiary care center with a community hospital feel, where people know each other, care about each other, and we're all on the same page as far as what our goal is.
Since being here at Tufts, my colleagues and I have created the Diversity, Equity, and Social Justice Committee, released anti-racism statements, published papers about racism in medicine, developed an initiative to facilitate shadowing experiences for underrepresented minorities in medicine, and also created the Underrepresented Minority in Medicine OBGYN Interest Group. I think that Tufts is an amazing place, and if I could do it all over again, I would choose Tufts. I hope that you decide to join the Tufts family.
Thank you for being with us on our virtual tour. We wish you the best of luck in your future endeavors.